happy hormones, chemicals are in brain. If people are doing any kind of physical activity, they release serotonin and dopamine.
Back pain का बहुत problem है, right?
Of
Neck
course,
pain का बहुत
yeah,
problem
yes.
है. What do you suggest for these kind of young people?
I believe prolonged posture is a issue.
What are the early warning signs? Like how we'll know that before it becomes severe?
So first symptom is pain.
But that happens every day, isn't it?
See, pain is a sign. Body is indicating there is something wrong with your body.
When the posture is imbalanced, of course it causes pain. I was just giving an example that I used to carry a wallet in my right hip pocket.
Let us say there is wallet in the pocket. That means it's changing the posture. One hip will be little up. It's changing the pelvis. If it's changing the pelvis, it is putting pressure on a muscle called piriformis. It's at hip level and sciatica nerve is passing through that muscle.
What is the most common emotional pattern or stresses which actually lead to the pain?
If people don't acknowledge their emotions on time, suppressed emotions.
How people find out like which particular thing will work for their body just without blindly following a particular trend?
I believe it is not about following the trend, it's about being conscious about lifestyle, overall lifestyle. Eat consciously.
Hi everyone, my name is Nitin Guru and I'm delighted to host you in another interesting episode of Medical Value Talks, where we invite experts from different medical fields to talk about their expertise and how they are making differences in healthcare. And today we have a very interesting topic in hand, and I couldn't wait to introduce to our guest. So before we start on the discussion, let me ask you a question. When was the last time you really felt pain-free? You got up and you continued with the routine and you had no pain in the body. If you couldn't think of the last time when you had such a day, then this session is going to be really useful for you. So without further ado, let me invite Dr. Ridwana Sanam, who is clinical director at ARS Healthcare.
Yes.
So Dr. Ridwana, welcome to the Medical Value Talks.
Thank you so much for inviting me.
All right.
It's a privilege.
So you do a lot of things and you've been into this industry for so long and working in different segments. So I probably won't do a justice of covering your introduction. So can you please help our audience to, with your introduction?
Yes. So my main core domain is I'm a holistic well-being coach.
All right.
So when we say coaching, it covers everything in well-being, like physical, which is my profession, physiotherapist. By qualification, I'm a physiotherapist and I have done psychology as well. But qualification is not enough because for a person like me, there has to be, I have to upskill myself time to time. So I had to do many other courses as well for well-being. I'm a corporate trainer. Then other side of it, as an entrepreneur, I was the founder of KRV Healthcare and Physiotherapy Private Limited. And now KRV has become ARS Holistic Wellness and Health LLP in 2025 April. So acquisition has happened and this organization is focused on mind, body, soul. So we are actually covering the physiotherapy, emotional well-being, mental well-being and the spiritual side of it.
Wonderful. So
thank you.
Starting with because again, physiotherapy and mental well-being and holistic well-being, we have always seen as a different
very true. Two different
streams.
Departments.
Yeah. Absolutely. How you came about the integration of these two department and how it is related? Is it related first of all?
Of course. Yes.
All right.
Absolutely. These are related because when we say mind, body, soul, see, mind is controlling the body. Am I right? The hormone, chemicals are supplying the body.
Right.
Even the nervous system is supplying the whole body. So we can say this is the remote control of the body.
Right.
And any aches and pains are dependent on the thought and emotion.
Right.
So when we say well-being, soul is the software of the body.
Wonderful.
Kind of a Wi-Fi.
Yeah.
And then nervous system is regulating it. It's the in charge. Like we can say all happy hormones chemicals are in brain. If people are doing any kind of physical activity, they release serotonin and dopamine. Am I right?
Yeah,
Which
yeah,
is physical
absolutely.
body.
Yeah.
Even a hug, a physical touch, a handshake is exchange of dopamine. It's the warmth. Am I right? So
Right, right, absolutely.
we are exchanging it.
Right.
So neuroscience and quantum physics
Mm-hmm.
has declared it
Mm-hmm.
that mind, body, soul has a very strong connection and they are connected with each other. Let us say someone is not feeling good, then body will also behave lazy.
Right.
Am I right? They
Right,
don't
right,
have
right, right.
reason to get up in the morning even.
Yeah, yeah.
They won't go to gym, no
Absolutely.
physical activity.
Absolutely.
If a thought is lower energy includes everything which is unproductive,
Right.
which is not beneficial to the self or
Yeah.
the other person.
Yeah.
So if thought is at that level, lower vibration, then emotion will be also following it. Person will feel the same emotion,
Right.
and it's going to affect the whole body.
Hmm.
Body will
Okay.
show the symptom. Yeah.
Right. I've seen that your work has prevented more than 85,000 surgery. Right. And first of all, want to understand like how you came to know about that, these situation can be avoided, because in many cases surgeries like hip replacement,
Yeah,
slip
very
disc,
true.
and all
Knee
those kind
replacement,
knee replacement.
ACL reconstruction, ACL injury.
Right, and these are like really serious surgeries,
Very true.
right? And even recovery takes
Yeah,
months,
very true. Very
right?
true.
So first of all, how you came to know about that something can be done around this, and uh, these many people have benefited, which is eye opening.
Yeah. So that has a connection with my childhood. So from the childhood, I was very, very much animal lover. I used to spend a lot of time with animals or birds, the animal kingdom or the mother nature. So I found the sensitivity and compassion in a person would not let them to become the surgeon. It's very difficult job. Am I right? I really respect surgeons. But going through the surgery process, when
Yeah,
you are
yeah.
doing a surgery and if you lose someone and you have to operate one more surgery after that, am I right? That means you have to be emotionally disconnected.
Absolutely.
Because you are a professional that time.
Yeah.
So I had this thing in my mind that that's not my strength. I cannot become a successful surgeon.
Surgeon, right?
And medicine is also not so easy. Studying medicine means specs is compulsory. Eyesight gets weak. So I was very protective about my own health, being very honest with you.
Sure.
So then after that, I decided to become a physiotherapist, because to become a medical professional where I serve the people, because the parents have ingrediented that into me to become a doctor. So I decided this is the one field which is easy.
Easy, right?
When I completed my education and internship, I realized that people have to go through the surgery. So that compassion came in between and sensitivity. Am I right? What can I do about it?
Yep.
And I'm very solution driven. I'm a practical person, action oriented. So I decided, why can't I design a protocol where we can prevent the surgery? And I realized in the depth, if you see the physical therapy as a profession, it is preventive, it is therapeutic, and it's corrective.
Right.
So we can correct the alignment on time. We can prevent the surgery easily by correct alignment and strengthening through the proper customized exercise program. So I realized there is a huge scope to prevent the surgery. People should not go through the pain. So that intentionally, that compassion, it was compassion driven mission to prevent the surgeries. And side by side, I was, I think, first consultant of Professional Golf Association of India. So where I got to treat lot of sports injuries. So I realized, when they play, there are like ligament tears, there are disc problems in the spine, or osteoarthritis, which is aging, because golfers are at a certain age, they can play till the age of 100 as well. They're very healthy. So I found there is a huge scope to prevent the surgery, because people are going through the ACL surgery, slip disc problem, in sciatica or radiating pain. So I found there is a huge scope of prevention management and then the lifestyle modification with the nutrition.
Okay.
Because jaisa an vaisa man. I realize if we eat well, the body will also show the good progressive recovery.
Wonderful. So that actually leads me to the common problem which nowadays even young people are facing. Right, बहुत सारे यंग बच्चे हैं जो कॉलेजेस में
Very
हैं
true,
और
very true.
उनको भी बैक पेन का बहुत प्रॉब्लम है, राइट,
Of
नेक
course,
पेन का बहुत
yeah,
प्रॉब्लम है,
yes, yes,
राइट, एंड
youngsters.
they feel lot of pain in their lower backside,
Very true.
right. I used to carry a wallet, and then it created a problem for me, so I personally had that kind of journey. What do you suggest for these kind of young people, how they can change their lifestyle, modify?
I believe prolonged posture is a issue. So I have been a corporate trainer since last many years, since 2013.
Right.
I was lucky enough to meet our former president, Dr. APJ Abdul Kalam.
Wonderful.
And where he told me that, your contribution should be such a way so that when you leave the body, people remember you.
Wow.
So he gave me the insight into prevention management. He gave me insight into my social perspective, which will come next.
Sure.
So I found whatever I am today,
Yeah.
my value system was built by him, by his
Wow.
suggestions, advice, his excellency. So there I realized prolonged posture. There is a program called RSI, repetitive stress injuries. So I had to deliver those workshops to multinational companies and corporates for many years for prevention management for the employees. So technology has some side effects,
Yeah.
but has a definitely benefits
Right.
more. Am I right?
Right.
So we need to understand we should not let technology to consume us. We need to understand what is the right way to deal with it for our
Yeah.
own benefit. Am I
Yeah.
right?
Yeah.
We should
Yeah.
use it. We should not get used by it.
Right.
So I decided to spread this awareness to the computer professionals that, or let us say I'm driving myself, self-driver, or I am a homemaker, I'm cooking at home, I'm doing household work.
Right.
So age group is not an issue. Even youngsters, they're playing sports. So repetitive stress injury means doing any activity repeatedly, even gymming. When we go to gym, fitness workout.
Right.
If I do abs every day, backache is 100% there. Am I right? It's part of
Absolutely.
sports injury is part of it. Technology injury, the aches and pains is part of it. Small child's or school students carrying the bag in a wrong manner, it's part of it. So in short, I can say the correct posture is required for everything. People need to learn what is the correct posture to deal with that particular profession.
Right.
Second is if they get any kind of wear and tear or aches and pains, they need to immediately take the action if they are health conscious, if they want to protect themselves, so that it gets healed 100% on time. And third reason for is prolonged posture. If they are sitting for prolonged hours, they may be sitting in a correct posture, but prolonged posture may develop muscle weakness. So physical activity is very important.
But what are the early warning signs? Like how we'll know that before it becomes severe? These are the signs when I should probably get maybe connected with you at your.
Yeah, very true. So first symptom is pain.
But that happens every day, isn't it?
Body is see, pain is a sign. Body is indicating there is something wrong with your body. So get the help. So people should seek help, professional help, as soon as possible, because there has to be a customized solution.
No, but if say a small pain is happening,
Stiffness
is happening. Is
Stiffness,
it sign of
pain? Of course,
Okay.
pain is the first sign. We should not ignore it.
Okay.
If we ignore it, then there will be stiffness. Then there may be radiating pain. It will trigger the nerve, neurological. That's the progression, how it progresses. Then it will restrict the movement. Am I right? The people will say, I'm not able to bend properly now. Because body will, our neck, if you see the posture, people will be looking like this. The neck will go 1 inch forward. Why? Because they're ignoring the pain. So pain is the activeness of the mind. It's showing, it's acute. If it becomes chronic, that means reoccurring of pain again, persistent pain. Reoccurrence of pain is the indication that there is something wrong with the body. And it has connection with the mind because nerves are supplying the body. Pain is a sensation.
All right.
So of course it's controlled by the nervous system. So if person is ignoring it, that means it will become a disease. Then degenerative changes will happen at the same joint, that is called arthritis, which is aging. Then there is, nowadays we are seeing early aging signs. Like in 20s also there is arthritis. So what can we do? So we get gray hair in 20s nowadays. I mean, right? That's a lifestyle. So
But
that
that
means
is also related with the pollution, the kind of
body will
atmosphere.
also show the symptom. That means as a person living in the metropolitan city or whatever circumstances are there outside, I have to take care of my body.
Right.
If I'm getting gray hair, that means I need to take care of my joints and muscles as well, because body will also show some symptom. It is better to
right.
do the exercises on time, take care of the emotional and mental well-being as well.
All right, all right. And is that also relate with, you already mentioned with the posture, but when the posture is imbalanced, of course it causes pain. I was just giving an example that I used to carry a wallet in my right hip pocket, and soon I realized that there is a lower back
Very
pain
true.
which started happening. So I consulted with again with a specialist, and he suggested that start carrying it in your bag or somewhere else, because otherwise it's going to be a very
Very
big
true.
problem.
Very true.
And yeah, I mean, luckily I survived because I took an
You had a
intervention at
suggestion on
right
time.
time.
So I can just give a very
Yeah,
simple
sure,
example. Let
sure.
us say there is wallet in the pocket. That means it's changing the posture.
Right.
One hip will be little up. Am I right?
Absolutely.
So it's changing the pelvis. If it is
Absolutely.
changing the pelvis, it is putting pressure on a muscle called piriformis. It's at hip level, and sciatica nerve is passing through that muscle. So
Right.
person can have a radiating pain also.
Absolutely.
Medically, we call it piriformis syndrome. That is, the muscle is getting inflamed because of the keeping something in the pocket, wallet. So remaining static, sitting in a good posture. In fact, this cross leg can also create a problem if people are habitual crossing one leg.
Yeah.
I said RSI, repetitive stress. Repeatedly, they are crossing only one leg.
Right.
They need to cross the other leg also to balance the pelvic control,
All right.
pelvic alignment. Am I right? If we keep body in the right alignment always for any kind of task or profession, body will not develop any kind of a problem then.
And what about shoes and different kind of
Yes, so
gears?
coming
Yeah.
back to the last question which you
Yeah.
said, knee surgery. So knees are getting overused.
Yeah.
Or back. So
Yeah.
the base, the foundation is our soul. Am I
Right.
right? The whole
Right.
body weight is on the
Absolutely.
soul. So
Right.
alignment, posture, gait analysis, we call it in medical terminology. If you see the alignment, the soul plays a very big role. So I believe one should invest for in footwear more than the clothing.
Oh, okay.
It has to be thick cushioned sole and the flexible. People can check the top and bottom of the sole when they are buying any kind of footwear for regular use. So if it is thick, cushioned, soft at home also, especially for homemakers, especially for people who are walking a lot, who are jogging, they should wear the jogging shoes, not the running shoes or walking shoes, because ligaments may get stressed out and wear and tear chances are more there. So some people nowadays, as per my experience, 18 years of experience, I have realized they have flat foot.
Right.
So if they don't have arch and they are wearing flat soles or heels or designer shoe most of the times, so you can imagine they may develop knee pain and or hip pain or ankle or lower back pain. So if we are modifying the sole, wearing a right sole and getting checkup done, if we get a very basic knee pain, ankle or hip, that means the indication is flat foot. So they have to get this checkup by a physiotherapist on time to make sure there is no flat foot, and if there is no flat foot, they need to wear a cushioned sole, and they can wear flats or heels or designers occasionally.
So what you are saying is that basis upon your body type, you should
Very true.
choose like what footwear, right? One should wear.
No, not body type. See, body
Not
can be
body
either
type. I
healthy
mean,
or
the feet type.
yeah,
Right.
feet type, feet
Yeah.
types. Yes,
Feet types.
yes,
Right.
yes.
And because most of the time, what happens, like you buy what you like more,
Very
right?
true.
Rather than thinking
I
about
said
what is fit,
occasionally. That is for occasional.
right? So whatever the coolest shoes of
Daily should
nowadays,
be comfortable.
sneakers, right? So
Comfortable.
comfortable.
Yeah.
It should be more comfortable rather than just beauty of it.
Of course. Yeah, that's the quality of life.
Right. Going ahead on the emotional aspect of it, you also do emotional counseling, right? So, what is the most common emotional pattern or stresses which actually lead to the pain, physical pain?
Unresolved trauma,
Oh, all right.
or if people don't acknowledge their emotions on time, suppressed emotions.
They can lead to the physical pain.
Of course, because if they suppress it, body will hold it, and body will show the symptom. So we call something is called stress related spasm. stress, anxiety, clinical depression, sadness has a lot of side effects on the body.
Can you give an
So
example?
let us say unresolved trauma. If someone lost some loved one, let us say in 2020, the world had to go through a lot of
Absolutely.
changes. So during this COVID,
Yeah.
so if someone loses anything, or if something is not happening as per their expectations, so frustration, disappointment, sadness, which is called clinical depression, when they don't feel good,
Right.
they have no reason to work,
Yeah.
or they think I'm just goalless, aimless, am I right?
Right.
Hopelessness, I can say
Right.
in simple
Right.
words. So, or anger issues,
Mm-hmm.
it's part of the frustration. Anger is part of this frustration, am I
yeah.
right?
Right.
So that means they are not in peace,
Mm-hmm.
they are not calm. These are the opposite energies.
Yeah.
Emotionally.
Right.
So if they don't address it on time, they don't acknowledge them on time, then body will start aching and pain, aches and pains. You know what happens? The spine will have the first effect, neck pain, lower back pain,
Wow.
or mid back pain also. Or sometimes people, because of the stress issue, they go to gym, they do over workout more.
Right.
Excess of everything is bad.
Yeah.
And if they eat, they will overeat, they eat more. So
Right.
either they're going to gain weight,
Right.
then body is again gone.
Posture,
Or
yeah.
if they are not sleeping well, because then deep sleep won't be there, am I right? Sleep disturbance.
Right. Right.
And they're not, actually the root was they're not addressing the emotion, they're not acknowledging it, they're not accepting that I'm sad, I need help. They don't seek help on time. They think,
Right.
no, it's not there. I am fit. I am fit.
Right.
So I believe it is a self. You cheat your own self because you don't recognize that there is something else in me because I'm not feeling good. That
Right.
feeling is not good.
Right.
So if feeling is not good, then why do I pretend to be happy? Pretending is a conflict, inner conflict. That means I didn't address it. It
Yep.
will come to the body.
Right.
And body will show if I do anything excess, even the workout excess, then wear and tear ligaments, slip disc, something will happen, or disease will attack the body faster, whether it is heart, hypertension.
Hypertension.
Diabetes is nothing, it is stress related, it's not sugar related. You can eat sugar as far as you are very calm and peaceful, nothing will happen to the body. But changes are at a very deep level, we call it quantum level. If you see, there is a mismatch of emotion, thought, and the body pattern.
So when you are saying that if such kind of stress or emotional, non-well-being can even try, impact on physical well-being,
Of course.
then probably these things will also be impacting on the healing part of
Of course,
it,
yes,
right?
healing
When you are
gets
recovering.
delayed. Healing, we have two types of patients.
Yeah.
I always say happiness is a state of mind. It comes, it goes. Am I right?
Right.
It can be
Absolutely,
like this.
Absolutely.
But peace is your authenticity. Peace is your birthright. As a child, you have come with the peace. And you have lost it because of the thought process. Am I right?
Right.
Now,
Absolutely.
something is missing. So I have realized two types of patients. Some people will come with a very dangerous, unresolved disease called cancer. But they're very happy. They have accepted it that there is a cancer in the body, which is autoimmune disease, and it's affecting the musculoskeletal system. And we have a very special customized protocol for it to protect the body. Whatever is happening in the body inside, they are going through radiation therapy.
Yeah.
Body has a tendency to get weak.
Right.
But I've seen they will still come with a smile. And someone has a simple back pain will come with a very crying face expression. Am I right? So if I have realized if people don't treat themselves internally, which is lifestyle modification, including behavior and lifestyle overall. So if they don't acknowledge them, the symptom on time, if they don't address it, they don't seek help on time, whether it is a mental health therapist, emotional counseling, or anything, any kind of a
Right.
counselor or psychology counseling, if they don't address it, you won't believe the healing takes so much of time. They are investing so much of money. They would change the doctors,
Right.
hospitals, maybe countries. They go to a better country then to get a treatment because they have enough money sometimes. Am I right? But they don't realize that internally, emotion and thought is not aligned for my complete recovery. So people are healing faster who are managing inner well-being, at least. Externally, the doctors are there to treat the body.
Absolutely.
Am I right?
Absolutely.
So I have found the recovery automatically reduces, the time. So people are able to save money. Time is money, am I right? And they are able to change the lifestyle also on time. See, if I have well-being, emotional and mental, then I am ready to change my lifestyle, the lifestyle which has created that problem. Then it is the right time to change the lifestyle which will resolve it, am I right?
Right.
जो प्रॉब्लम क्रिएट करेगा वो रिजॉल्व नहीं कर सकता.
सही बात.
रिजॉल्व होने के लिए आई हैव टू बिकम अ न्यू पर्सन.
Absolutely.
So they are very flexible, personality wise. They would adopt the new lifestyle. They would change their diet faster. There is something called anti-inflammatory diet. If there is inflammation in the body, pain, aches and pains are all inflammation. So they would change it very fast and they recover with very minimum sessions.
Right.
Even mental well-being, I have realized even people, if they are in clinical depression or stress, anxiety, my 3 sessions are enough for them.
Wonderful.
So within 3 sessions, I can decode their sadness. We call it, we will detach them from the sadness. So they become very pleasant automatically.
And then recovery is faster.
Recovery is faster. Very
because
true.
they are peace with it and they are kind of thinking positively about it.
Yeah, because brain will release the healing chemical and hormone in the body.
I'm not sure like how true it is, but I heard like people have cured cancers also.
Of course, yeah.
Okay.
I'm the witness. I know a lot of people who have tendency, we all human beings are blessed with the energy. Pranic healing is nothing. It's like you are activating your own energy system. Am I right? So every human being is on a unique code. So we have healing energy within us. People call it heart energy center. So there is an electromagnetic field. Am I right? So if this is activated in a right manner, it will take care of the hardware automatically. It's like software is upgrading, which is as a person, it will motivate me, which is called self-motivation. It comes at the soul level. I will be motivated enough to look after myself, which is self-care. Am I right? Prevention management.
Yeah.
Realizing that body is sacred. It's a divine gift. I need to take care of it.
Right.
I am the custodian of the body. I am not the owner of the body. I have no authority to damage it. And if damage happens, which is part of the human journey, I need to acknowledge it on time and put all my sincere efforts to bring it back to the well-being.
I think that leads me to another question where it is about inner awareness and then well-being. And you often talk about integration of well-being and
physiotherapy, like physical, mental.
Right. So what is that beyond? Because heard about it number of times, but no one can probably explain in a way which can anyone can understand, even people like me who are probably very skeptical about non-physical aspect of it.
I
because
understand.
Sometimes it overlaps with the spirituality and kind of non-physical, non-chemical.
See, it is scientific. I'm a scientific spiritual healer.
Yeah.
I can say it is scientific. Spirituality is not something imaginary. It's who you are. You as an authentic person. Who you are as a being. So we are not human thinking. Am I right?
Yeah.
That's our quality, intelligence, thinking body, intellect.
Right.
We call it intellect. Am I right? You can address it. You can study about it. You can become a professional about it.
Right.
But there is something called human doing also, which is our action, karma. Am I right? Whatever we do. So that is, again, we are not that. We are human beings. So when you realize that you are a being, that means you are a spiritual being experiencing human life. But people have a very different concept. They think spirituality is something imaginary which we have to find out. Right. And we become spiritual. No, we become good human beings. We upgrade our character, behavior. Human behavior is very important. Am I right? I can make you feel pleasant, and sometimes the bad behavior or expression may disappoint you also. Am I right? So that means human behavior plays a very big role to be a good human being. So I believe integrating physiotherapy with emotional well-being or holistic wellness, whatever we call it, means to become a good person as a human being in the sense with balance and harmony. Means you are able to balance your professional life and your personal life. And inside you are able to balance the heart and mind plus body. So heart means emotion, this means thought, and the body, because they are sync, they are
Sync.
together. That's
Right.
called well-being. So I was lucky enough to study all of them scientifically and become a professional where I could contribute to lakhs of patients, more than 3.5 lakh patients
Wonderful.
in my
Wonderful.
18 years of career.
All right, that's amazing. But at the same time, there are a lot of wellness trends going on
Very
currently,
true,
right?
very
A
true.
lot of people are saying that now you should take protein-rich diet. There are different type of shakes available. There is even protein sodas
Very true,
available.
very true,
There are such kind of trends like ice plunges, which
very true.
I really hate in winters. But yeah, so there are a lot of trends, right? With especially with the Gen Z
I'm
and
also very warm. You can imagine. You can imagine through my clothing.
so so how people find out like which particular thing will work for their body just without blindly following a particular trend.
I believe it is not about following the trend. It's about being conscious about lifestyle, overall lifestyle. Eat consciously.
Okay.
I have seen people, even one of the actress, no, died because of some dieting. Is it? We
Right.
lost one
Yeah,
of
yeah,
the
yeah,
renowned
yeah,
actress. I don't
yeah,
want to
yeah,
take the name, but
yeah,
everyone
yeah.
knows
No,
it.
no,
So
I
they
can
are
understand. Yeah.
famous, so everyone knows it. Otherwise, there are many people who are, I know because I'm into this, I'm in the industry. So we have been treating all kind of famous personalities of this country.
Yeah.
I was lucky enough to serve them. So I have realized, they look good, they will be very fit and fine,
Yeah.
but they have a lot of diseases inside the body.
Oh.
So I found it's not the trend. We need to be conscious.
Yeah.
Conscious in the sense, I'll tell you something about myself. If I have
Sure.
to eat aloo parantha as Indian
Mm-hmm.
or any carbohydrate
Right.
diet,
Yeah.
I feel
Yeah.
like, let us say ice cream, I won't stop myself because that craving will generate a stress hormone inside your brain.
Right.
It's like a baby, am I right? Brain
Yeah.
wants something. You have
Yeah.
to feed it little bit
Yeah.
in moderation.
Right.
So I will give command to my nervous system,
Right.
my intelligence,
Right.
because I believe I would like to add something which is a little different.
Yeah.
I believe I am a soul in the sacred body, and my brain is my CEO to execute pleasantly, to remain
Right.
in a balance.
Right.
But this should not dominate me. It wants to have anything and it will have in excess. Am I right? Because I know excess of everything is bad. To train my faculty all the time, I'll feed it ice cream, but I will bless the ice cream first. That is called change of energy.
Wow.
I would like to share this because on internet or AI is available nowadays.
Yeah.
Everyone says don't eat this, don't eat that,
Absolutely.
and people are no command for the brain is very dangerous. Brain
Right.
will seek it 10 times more. No means yes for the nervous system.
Okay.
So
is
we
it-
can say,
okay.
oh, avoid this.
Yeah.
When I do counseling, I would say, let us avoid this for some time. Then it's not, there is no pressure, there is no force on the nervous system.
Right.
So as a human being, I want to taste everything. One need to bless the food first. That is called conscious eating. Consciously, I am feeding my body because I know it is going to become life inside my body. It is going to become blood, cells. Am I right? Whatever I eat, it will decide what has to happen inside. So generally, when we say cheers for the success, am I right? Sometimes
Right.
when I touch any food, why can't I bless it peace and good health? And I command it that whatever is not, because there is someone who's on auto mode operating my whole body. Am I right?
Right.
Inside, whatever you call it energy, you call it soul, you
Yeah.
call it whatever you
Yeah,
wish.
yeah.
There are different terminologies,
Yeah.
but we are addressing one life
Yeah.
force.
Yeah.
So I'm commanding the food that whatever is not beneficial for my food, may it get excreted. So it will come out of the system automatically.
Wow.
And it won't have any effect on the body. Why? Because I have been eating it, consuming it with a conscious thought.
Right.
I have changed the energy now. So I believe person can follow the trends as well, but in moderation.
In moderation.
Moderation. Otherwise, body will get habitual of something, and then in future, if they leave it, have you realized people lose weight and then they would gain it again?
Absolutely.
Yeah, they are not understanding the well-being of the body. That thought has to accept that moderation is good for me. If I eat aloo parantha, then I would like to skip the dinner that day because I know I have eaten little
Heavy.
different
Yeah.
diet.
Yeah.
So I believe we can modify the lifestyle. we can focus on nutrition rather than dieting. Starvation is not good for the body. Then कुछ न कुछ deficiency रहेगी body में.
नहीं, और आपने ये जो बोला कि blessing the food, that actually reminded me that in childhood my parents used to perform a
bless.
prayer.
Yeah.
Say blessing before you eat.
I also do.
And of course, as we grow, we lost
I
the
know,
touch
I
and all
did,
those things.
I
But
remember it. I
yeah,
remember because it
wonderful.
was, my Nanaji was a saint. So, my Nanaji was very evolved soul. I believe if something, one is just saying that just bless the food and that's enough. But if I don't tell my child or my friend or my family member or loved one or as a counselor to the other person, what is the reason behind it, how it works in your body, they would never ever forget it.
Absolutely.
I believe understanding, deep understanding is very, very important to develop a habit,
Right.
a good habit and maintain it forever.
Right.
We call it sanskar ko pakka karna in Indian language. Am I right?
Right. Yeah,
It's a habit. You understand it's serving me.
Right.
It is serving other person also.
Yeah.
If I'm health conscious, I'm eating healthy and you are my friend, automatically we call it sangat ka asar
Right,
in
right,
India.
right, right.
So automatically the other person will also become healthy. Whoever has a higher energy will have impact on the surrounding person or the environment.
Wonderful.
So our electromagnetic field is actually radiating all the time energy. That means we are responsible for the environment, for the planet. That means pollution is not only the air pollution. Pollution can be mental, pollution can be emotional, lower emotion. Let us assume a hurt. It's such a simple emotion for people. Everyone will blame other person that I am hurt.
Right.
Because of the other person. Am I right? It's a blame game at a subconscious level.
Right.
So a simple emotion or sadness, the person is radiating sadness actually.
Right.
So a simple emotion is a lower emotion is pollution. So as a sensitive, conscious human being, it is my sense of responsibility
Right.
towards my own well-being first and the environment, planet or others that, hey, what am I radiating? Whether it is social media or offline.
Right.
Am I right? Online or offline.
Yeah.
Person has a sense of responsibility and accountability to radiate the positive energy.
Wonderful.
High, we call it high vibration energy, frequency wise, as per quantum physics. Now, you can imagine if my good habit is serving me, that means it will serve the other person also.
Right.
And brain is very tricky.
Yeah.
Brain will always change the pattern. Why? Because brain will take us towards, sometimes brain has two parts. One is divine and one is devil. Devil will encourage towards the lower habits. And divine side will always encourage towards the better habits, which are my actually human attribute and divine attribute inside us. Am I right? The play is happening inside.
Yeah.
Now, if I want to have a fit body, I feel good. I will get confidence. Am I right?
Yeah.
I will be able to perform all my life duties.
Absolutely.
So that means for that, a good habit management is important every day. It takes 30 minutes to write down on paper what all good things I did today and what I could have done better. There is nothing wrong. There is actually a better learning every day.
Right.
So people can maintain the journal.
Right.
They can ask themselves 3 questions. What is my state of mind? How are my thoughts today?
Right.
They can ask second question, how are my feelings today? Emotionally, how do I feel today?
Right.
Do I feel contented or do I feel satisfied? If not, then what can I do better tomorrow? Because there is one more day given to make it better.
Right.
And then third can be, how can I improve my diet? How can I eat healthy?
Wonderful.
So they can bless the food and they can have internal pleasant thoughts and emotions and body.
Very nice. Very nice. And now from the conscious world to physical world, I think you carry a lot of experience in treating the physical pain.
Very
right?
true.
Can you suggest some few simple exercises to our audience?
Yes.
So they can probably get relief from their small pains like neck pain, which I keep having very often, and then small back pain, etc. So if you can, help with.
So earlier when I was awarded by appreciated, I can say, for preventing surgeries, thousands of surgeries. So at present the data says more than 85,000 surgeries and healed more than 3.5 lakh patients. So the whole overall experience of 18 years of experience, I have realized people can manage 10 minutes anytime in the day.
Right.
It's all about time
Yeah.
management,
Yeah.
and
Yeah. Yeah.
they can get up 15 minutes before.
Right.
They can just modify their sleep. Am I right? There is nothing
Absolutely.
called busy lifestyle. There is all about time management. Our
management.
prime minister is managing time for the whole
Absolutely. Right.
world.
Yeah. Yeah.
And a simple employee will say, I don't have time. So it's all about
Yeah.
learning from each other,
Yeah.
time management.
Agree.
So if we can manage time, prioritize our body, I
Right.
believe these exercises may take hardly 5 minutes per
Okay.
day to
Okay.
maintain the right posture of
All
the
right.
neck.
All right.
So the better would be sitting straight
Mm-hmm.
like this.
Mm-hmm.
And one can just lift the neck up, shoulders up, up, back, and down. So shoulder blades have to go towards the midline.
Okay.
This is up, back, and relax. Again, up, back, and relax. So this will automatically mobilize the shoulder blades, and it's a good command to the body that hey, relax.
Absolutely.
Generally due to stress,
Yeah.
or when we are preoccupied, focused on work,
Yeah.
shoulders will be like in tension, like this,
Like that.
clenching
Yeah.
up teeth,
Absolutely. Yes.
jaws. Am
Yes.
I right?
Yes.
So people can just do this movement. They can just stretch the body up. They
Like
can
this.
stretch
Yeah.
in front. They can even, because
Yeah.
of typing
Yeah.
or doing anything or driving or holding, doing household work. So hand muscles are very small
Yeah.
muscles. So they can just do this to avoid the wrist pain or finger pain. This is relaxation technique for the wrist. And for jaw, you can see they have to put a finger
Mm-hmm.
like this. First to see this is, locate that this is my jaw. This is the exercise.
Mm.
Then front to back.
Very
There.
nice. Yeah.
So it is like mobility exercise. Open and close. I'm doing this intentionally. Throughout the day, I'm actually using it, using the
Right.
muscles.
Right,
Now,
right.
when I do it intentionally, I'm relaxing the muscles.
Mm.
And they can massage also like clockwise and anti-clockwise, just 10
Right.
times, 10 repetitions. Same will go to the head. This, if they have little bit of a headache or migraine, the thumb should be pressed against this, and they can just put two fingers on top of the head, middle of the head,
Yeah.
this, and then do little bit of a press here
Press.
with the thumb and relax, press and relax. For eyebrows, they can just hold them, squeeze them, and release. This is for very good for eyebrows while using the screen all the time. So after every hour or 5 hours or end of the day, at least once they can do
Right.
it.
Right.
Now we can see for eyes, we can just do this and relax, so that we are relaxing the muscle. Actually, this is an exercise. Or look very far, whatever. If I'm looking at the screen, I should just look at the corner or the up. So it is actually the neck movement also. You can see
Right.
this. Or I can just do this. This is also a good exercise. Stretching body back. I'm using the front posture. I'm just stretching it back. It's such a simple movement.
Right. Right.
Yeah.
And yeah, I'm sure that these kind of relaxes the body.
Very true,
And,
very
and
true.
elevate the pain. Which,
Yes, yes. Due to stress or anxiety,
Hmm.
we have sometimes a project going on. People have a lot of, even the sports personalities, they have a lot of anxiety when they
Right.
are preparing for something. So clenching of teeth is very common. That can have that can damage the teeth.
Right. Right.
Am I right? Then they have to go to the dental treatment.
Dental
It's very
treatment,
expensive.
surgery.
So person has to relax the jaw
Yeah.
every night and shoulders. This is before sleeping. This is very important exercise.
Okay.
And to align the mind, body, soul, we call it deep breathing exercise. I would like to share a technique which can relax
that
the
will
whole
help.
body.
Yeah, yeah.
See, theoretically discussing it is very easy. People have enough of information, but I believe they need solution. What to do? A quick
Right.
solution, simple
yeah,
solution.
yeah.
So they can just sit straight. Spine should be straight, and then they can just close the eyes. Why? Because they have to bring all thought process to the body. It's so easy. They can just look at themselves from top to bottom. That means it will bring attention back. And then after that, it's a deep breath. Count for 3 slowly. So they have to visualize here 1, 2, and 3. This is a scientific method called a frequency code 369 for well-being.
Okay.
It's so simple.
Right.
It will bring a lot of calmness. It's the calmness code. If I'm calm, I'm able to deal with the external world. Doesn't matter what challenges are there. Am I right?
Right.
So to overcome the restlessness or overthinking, this is a very simple breathing technique, frequency cold call 369. Breathe in, count for 3, hold for 6, count here 1, 2, 3, 4, 5, 6. Because then visualization is important. It will
Right.
bring all thoughts back to the body.
Yeah.
And then release is so easy. So I would release it through nose and or mouth, whatever is possible, and count for 9. So exhale and inhale, there has to be a 10 seconds hold.
Wow.
Now I'm going to perform the technique. This
Right.
is 10 seconds. Hold. And then again 3, 6, 9, 10 seconds hold. Minimum 3 breaths.
369.
3 breaths will bring the person calm down and they can have a good idea if they're finding a solution.
Right.
It's very
Wonderful.
easy. Brain will
Yeah,
give the
I think
maximum
this can
output.
be done in any time
It's
of the
called
day.
reset
Yeah,
technique.
reset.
You're resetting
Yeah.
your whole system.
Wonderful.
You are saying the nervous system, hey, give me the
Yeah.
best solution.
Wow.
Yeah.
Wow. Wonderful. I think all these practical tips and the exercise you showed will tremendously help our audience. Thank you so much, Dr. Sanam. It
Thank you
was
so much.
pleasure to have you. And before we kind of come to a closing, want to just ask you about your closing thoughts for the audience who probably going through physical or emotional pain,
Yeah, very
right?
true.
How they can deal with it, and if you think like there are times when they should connect with you or your therapy wellness center, when they should come, right? So on that, if you can just leave a closing remark, that would be helpful.
I would like to say that pain is a divine signal that seek help. We are human beings, we should seek help on time, seek a professional help. And in any case, if you need my assistance or support, I can help you in any ways. You can search me online, Dr. Ridwana Sanam, on Google, and you will find out the details. And please reach out to us, send us one WhatsApp, and we will get back to you for sure. Thank you so much.
Wonderful. It was pleasure to have you, Dr. Sanam, and the whole session was really insightful. I learned a lot. So thank you so much, and I'm sure the audience would love our discussion and benefit a lot from it. So thank you. Thank you
Indeed,
once
it's
again.
a privilege to be here. Thank you.
Thank you.